everyone, I'm Dr. Chinyere Ugoji, MD, MBA, with interest in healthcare, education, leadership, public health, and graduate medical education application through the Electronic Residency Application Service 2015, and participants in the American Medical Association mock interview 2015, welcoming you to Dr. Chiquito Mentoring Iridescence Global Collaborative Educational Ustream YouTube show. I would like to share these quotes with you. At each and every juncture of our history, somebody has been audacious enough to say, we could do better, and most often than not, it's been young people who have done it. President Barack Obama, February 2nd, 2007. This program will mentor and cultivate young leaders of today and tomorrow, and I am glad that they will have this opportunity to serve. I look forward to working with those who are selected to participate, and I want to commend all who apply for their desire to help through public service to forge a brighter future for our country. President Barack Obama, May 22nd, 2009, on the White House internship. Education is the key to success for so many kids, and my goal specifically is to reach out directly to young people and encourage them to take charge of their futures and complete an education beyond high school. First Lady Michelle Obama, January 16, 2014. Education is indispensable to the success of every individual, and is the motivating factor behind my my graduate medical education curriculum and interest in the Reach Higher initiative, motivated by the First Lady Michelle Obama, inspired by this quote by the First Lady Michelle Obama, and a determination to focus on education. Dr. Chinyere Ugoji, MD, MBA, October 25th, 2014. I would also like to share some other quotes with you. But first of all, I would like to state that I have an application for the Electronic Residency Application Service 2015, and submitted documents through the Electronic Residency Application Service Secure Portal, which include the Medical Student Performance Evaluation or Dean's Letter, medical school transcripts, letters of recommendation, photograph, ECFMG status report, USMLE transcripts, personal statements for internal medicine, family medicine, psychiatry, and pediatrics, and then some other documents which include the American International School of Medicine diploma, the American Board of Family Medicine score report, the United States passport, the Educational Commission for Foreign Graduate Medical Education certificate, the American International School of Medicine transcripts, senior school certificates, examination from Owerri Girls Secondary School, United States Medical Licensing Examination Step 1, Step 2 Clinical Skills, and Step 3 score reports, the United States Medical Licensing Examination USMLE certified transcript of scores, licensing documentation verified and updated in 2014 with national licensing organizations. And I would also like to share some other quotes with you. This is to inform you that Ms. Chinyere Ugoji was hired by Always With You Home Care as an independent contractor, and except from a letter of recommendation from Always With You Home Care LLC service at your doorsteps. wish you good luck in your future endeavors, and except from a letter of recommendation from Dr. Janet Albers to Dr. Chinyere A. Ugoji, MD, MBA. Dr. Chinyere A. Ugoji, MD, was noted to be kind and personable, and except from a letter of recommendation from Dr. Kimberly Baker-Janol, Program Director Emeritus, Henry Ford Internal Medicine Residency Program, Detroit, Michigan. I am writing this letter in support of Ms. Chinyere Ugoji's application for residency. I have had the opportunity of working with Ms. Ugoji as her attending physician during her family medicine clerkship. During the 8 weeks of the clerkship, my interaction with Ms. Ugoji was quite enjoyable. She was a hard-working student who was very eager to learn. She impressed me with her maturity, ability to be a team player, and to go the extra mile. Her personality was very pleasant, and she was well liked by the staff. Ms. Ugoji always carried out her assignments and conducted herself in a professional manner. She was well respected by the other students and was a great example for the other students to follow. I was very impressed by her enthusiasm for learning and improving her clinical skills. Her clinical presentations were very good, and she presented them in a timely manner. Her write-ups were well written and very legible. Her fund of knowledge was solid for her level of training, and her presentations were. In closing, I am recommending Ms. Ugoji to you with great enthusiasm. Ms. Ugoji will be an asset to any postgraduate training program, and except from a letter of recommendation by Dr. Otis S. Powell, Jr., MD. It is my pleasure to write this recommendation on behalf of Chinyere Ugoji for a residency position. I had the opportunity to work with Ms. Ugoji as one of her medical students. Ms. Ugoji participated in a surgery rotation with me at Northside Main Campus and Emory Crawford Lung Hospital in Atlanta, Georgia. Her duties involved physical examinations, clinical assessments, and case presentations. Ms. Ugoji showed tremendous aptitude in grasping medical concepts, making associations, and applying various theories. Her keen perceptiveness and diligence as a student allowed her to make valid judgments and assessments when called upon. As part of our evaluation, Ms. Ugoji was required to present case presentations during our didactic sessions before and after patient examinations. I was most impressed with her clinical acumen. She made accurate clinical observations and formulated good management plans. In addition, Ms. Ugoji had excellent rapport with the patients. She was not only able to attain necessary information from them, but also to put them at ease very quickly. Her excellent interpersonal skills extended also to her colleagues and to my office staff. She was well respected by her peers and others she came in contact with in my office. Besides the requisite skills Ms. Ugoji possesses, she also brings a compassionate spirit and insatiable desire to succeed. I support her for residency training without hesitation, and except from a letter of recommendation by Dr. O. Bruce Case, MD, FACS. I had the opportunity to work with Chinyere Ugoji during the period July 7th to July 31st in my family practice and pediatric office at the professional office at St. Elizabeth Hospital, Chicago, Illinois. She worked under my supervision as an extern, seeing adult patients and pediatric patients. She did case presentations, performed vital signs and weights, and presented various topics. I was impressed by her history-taking skills and ability to quickly establish a rapport with the patients. She participated actively in combining the signs and symptoms of various diseases to arrive at differential diagnosis and treatment regimen. She exhibited outstanding clinical knowledge. She made accurate clinical observations and came up with good management plans. Chinyere Augusta Ugoji came across as a very hardworking, reliable, and intelligent young lady who will make a very good resident in any residency program. She was also able to develop good rapport with the pediatric patients as well as adult patients. She exhibited professional behavior and was willing to go the extra mile to help others. She also exhibited excellent interpersonal skills towards her colleagues and office staff. She was viewed with respect and affection by her colleagues, staff, and patients. I have no doubt that she will excel in residency. I think she will make a good physician. Please do not hesitate to contact me with any questions about Ms. Ugoji, and except from a letter of recommendation by Dr. Saida Zahidi, MD, Program Director Emeritus, St. Elizabeth and St. Mary's Family Medicine Residency Program, Chicago, Illinois. Ms. Ugoji served in 1 month of the ophthalmology rotation in this office in 2006. She has shown herself to be an outstanding individual with a keen intellectual grasp of medical issues, combined with the compassion necessary to care for patients on a long-term basis. Many ophthalmology patients are elderly and are infirm, and I was impressed with her ability to deal with this population. With a quiet yet confident and competent demeanor, she is able immediately to put patients and staff at ease. She works well with ancillary personnel and is intellectually demanding. After a time in the office, she was totally familiar with workup and testing procedures, and she carried out her duties in an exemplary fashion. She also maintained a steady study schedule related to the monitored cases and diseases. I believe Ms. Ugoji will become a fine physician, and she has a qualification to enter any specialty or field in which she may have an interest, and except from a letter of recommendation by Dr. Jetty Burnett, MD. I would also like to share my personal statements with you. Your Dr. Chiki Mentoring Iridescent educational collaborative global Ustream YouTube show. My internal medicine residency, my internal medicine personal statement. My choice to be a physician stems from educational and physician leaders from early developmental years to graduate medical education, and real life stories of patients whose lives have been transformed by healthcare in my family, patient care, and various charity works, and be a part of effective, innovative, cutting-edge healthcare delivery. Hello everyone, I'm Dr. Chinyere Ugoji, MD, MBA, a 2007 graduate of American International School of Medicine. My typical introduction to community educational Ustream shows discussing the quintessential skills for patient encounter and components of the clinical decision-making process, and the role of graduate medical education curriculum with its diversified topics ranging from emergency protocols, patient encounter, coding and billing, electronic health care records, and practice management, contributing towards effective healthcare delivery. Healthcare integrates the fine arts of addressing patients' symptoms and physical examination findings, integrating humanitarian qualities, pharmacology, and psychotherapy, which have worked in the past. Healthcare reform with its continuous innovative healthcare delivery, creating healthcare opportunities from the United States of America, Taiwan, Africa, and Russia with healthcare professionals, systems, and health information technology with personalized patient-centered approach, didactics, and healthcare delivery systems, specialization opportunities especially hematology and oncology, makes internal medicine my choice of specialty. My clinical career has been shaped by medical education at United States Medical Licensing Examination scores of Step 1, Step 2 clinical knowledge, Step 2 clinical skills, Step 3 scores of 88,212, 98,257 pass, 88,212, and improved with training from clinical rotations in the United States at Atlanta Medical Center and Crawford Lung Hospital, Atlanta, Georgia, observerships at Texas Health Harris Peters Hospital, Fort Worth in internal medicine with Dr. Fidelis Zineni, and Huntsville Family Medicine Residency Program, Huntsville, Alabama, in Family Medicine in Training Service with the Program Director, Dr. Mary Cristani, and the inpatient team. Externship at Resurrection St. Elizabeth's Hospital Family Medicine Residency Program in Family Medicine with the Program Director Emeritus, Dr. Saida Zahidi, and graduate medical education training at Henry Ford Internal Medicine Residency and Southern Illinois University Family Medicine Residency Program, Springfield, Illinois, with inpatient, outpatient, and obstetrics and gynecology rotations, with program directors, Dr. Kimberly Baker-Jinor and Dr. Janet Albers, and continuously updated with graduate medical education and caregiving in Dallas, Texas, and enhanced with a Master's in Business Administration, called Public Health Administration, and ongoing public health. It was amazing to see the changes which occurred in the past few weeks in 15-year-old Caucasian male with caregiving, incorporating occupational therapy, speech therapy, and physical therapy with past medical history of cerebral palsy, whose chief complaint was abnormal muscle tone, asymmetric crawling or failure to crawl, growth disturbance and failure to thrive, and gross motor developmental delay, which has improved progressively over the past few months, and family history of genetic disorders and current preventive care on gabapentin, 15 milligrams twice daily orally, and phenobarbital, 100 milligrams in 10 milliliters, and no known drug allergies, with concordant review of systems and physical examination findings of decreased visual acuity of 20/200, 2 centimeters well-healed scar in the umbilical region, with a gastrostomy tube, 2/5 muscle strengths, decreased muscle tone and bulk, decreased coordination, normal sensory function, 3+ deep tendon reflexes, contractures, decreased range of motion, differential diagnosis of inherited metabolic disorders, metabolic myopathies, decreased range of motion, metabolic neuropathies, movement disorders in individuals with developmental disabilities, traumatic peripheral nerve lesions, tumors of the conus and cauda equina, and vascular malformations of the spinal cord, with laboratory findings, orders and findings of elevated serum lactate, pyruvate levels, ammonia levels, elevated organic and amino acids, cerebrospinal protein, chromosomal analysis, imaging of computed tomography, CT scan, magnetic resonance imaging, electromyography, EMG, nerve conduction studies with evoked potentials, consults with neurology leading to an assessment of cerebral palsy, with a plan of continuing medications, feedings with gastrostomy tube, physical therapy, occupational therapy and speech therapy, follow-up in 3 months, and coding and billing of ICD-9 343, ICD-10 G60, and billing of 9925 as a new patient due to the comprehensive history, the physical examination, and high complexity decision making done in 60 minutes. The 33-year-old African American female was in severe distress and crying uncontrollably when she was brought in by the ambulance in the emergency room and said, "I was raped," as the chief complained. In 1 hour with history of present illness of inflicted physical injuries and unprotected sexual abuse, past medical history of depression, past surgical history of a cesarean section 5 years ago, obstetrics history of last menstrual period 4 weeks ago, every 4 weeks, on oral contraceptives, current preventive care, social history of unemployment, high school graduate, single and use of marijuana for 7 days, and no known drug allergies with concordant review of systems, physical examination findings of severe distress, bleeding, lacerations on face, arms, and trunks, vaginal lacerations, and differential diagnosis of blunt abdominal trauma, abrupt shear placenta, acute coronary syndrome, alcohol and substance abuse evaluation, soft tissue injury, anxiety, asthma, vaginitis and malingering, and laboratory orders of urine or serum pregnancy tests, serologic tests for syphilis, hepatitis B, human immunodeficiency disease, vaginal culture for wet mouth, gonorrhea, chlamydia, trichomonas vaginalis, bacterial vaginosis and candidiasis, procedures of colposcopy, consults of obstetrics and gynecology and psychiatry, an assessment of sexual abuse and treatment plan of ceftriaxone 125 milligram intramuscularly in a single dose, metronidazole 2 grams orally as a single dose, and azithromycin 1 gram orally in a single dose, and 2 overall tablets and 2 tablets 12 hours later for pregnancy prophylaxis, tetanus, hepatitis B prophylaxis, and counseling with a sexual counselor. Follow up with obstetrics and gynecology in 1 week, and coding and billing of ICD-9 E960.1 T 74.2, and billing of 9902 as a new patient with detailed history, physical examination, and low complexity decision making in 30 minutes. It was a great learning opportunity with the obstetrics and gynecology team at Southern Illinois Family Medicine Residency Program when the 33-year-old Asian female came in and said, "I'm having uterine contractions and a headache," as the chief complaint, with history of present illness of uterine contractions every 5 minutes, rupture of membranes with medium amount of clear amniotic fluids, fetal movements every 5 minutes, lightning, changes in breathing, frequent urination and no vaginal bleeding, pathological history of urinary tract infection, obstetric history of first gestation, no preterm, aborted or live pregnancies, current preventive care, social history of married, physician, graduate school, living with husband and exercises 3 times a week, and no known drug allergies, concordant review of systems and physical examination findings of hypertension, cephalic left occipital anterior presentation, contractions every 5 minutes, and fetal heart rate of 150 beats per minute, and a digital vaginal examination results of 10 cm cervical dilation, 100% effaced, anterior cervix with a firm consistency at zero station, differential diagnosis of normal labor and delivery, preeclampsia, urinary tract infection, cervical lesions, ectopic pregnancy, myomas, and ovarian tumors, and laboratory orders of complete blood counts, blood typing and screening, urinalysis, serum alanine aminotransferase ALT and aspartate aminotransferase AST levels, creatinine, uric acid, 24-hour collection for protein and creatinine, peripheral blood smear, serum lactate dehydrogenase levels, indirect bilirubin, coagulation profile, that's prothrombin time, and PTT, and activated partial thromboplastin time. and fibrinogen, imaging of head computed tomography, trans-abdominal ultrasonography, umbilical artery Doppler ultrasonography, and cardiacotography, pulling tests, nitrazine paper tests, and fen tests, which are usually performed, imaging of external tochometry, monitoring and intrauterine pressure catheter, bedside ultrasonography, cardiography, electronic fetal monitoring of fetal scalp electrode, fetal pulse oximetry, procedures of establishment of intravenous IV access, consults of obstetrics and gynecology with assessment of labor and delivery, preeclampsia and treatment plan of delivery and pain management, labor augmentation and blood pressure control, meperidine, 25 to 50 milligram, oxytocin 1 milli international unit per minute intravenously, and hydrolazine 5 milligram intravenously, and delivery of fetus and placenta. Follow up in 1 week after discharge, coding and billing of ICD 9, ICD 10 labor and delivery, 650, 650 and 080, preeclampsia ICD 9 or 10, 642 or 642.7, 011, 014, and billing of billing for 99215 for comprehensive history, physical examination, and high complexity decision making in 40 minutes. My personal statement talks about various cases which I have seen in my career as a physician in graduate medical education, and which we'll discuss extensively with real life presentations on how to handle these cases, even as we encounter them on in graduate medical education. And the complete discourse of my personal statement can be found in some of my previous shows. And I have personal statements on internal medicine, family medicine, psychiatry, and pediatrics. So so next, it's currently 8:29, and you're on Dr. Chiquito mentoring Iridescent's educational collaborative global Ustream YouTube show. And I would want, and next we're going into the next section, which is the graduate medical education interview session for those who are in for the interview season for 2015. And first of all, we'll talk about the graduate medical education interview question for the interviewer, which could be the program director, the faculty, the resident, the medical student, or the staff. And that question would be, are there any required rotations that take place outside of the city? This is an important question that allows the interviewer to share the rotations that occur outside the city where the graduate medical education program is located. And next, we'll go to the section of the question for the interviewee, which could be you or me, even as we undergo the expedition for the perfect graduate medical education program fit for achievement of your graduate medical education goals. And that question would be, and we'll talk about and I'll digress a little bit to talk about the last question that we missed from the last show. And that question would be due to technical issues. And that question would be, what are your hobbies? And my answer to that would be, my hobbies include healthcare, education, charity works, and dance sets. The question for today will be and why did you choose healthcare? My answer to that would be I chose healthcare because of the continuity of care, the longitudinal care, the healthcare delivery models, and the specialization opportunities available in healthcare. After being part of effective healthcare delivery as part of a collaborative team. And with that, it's 8:32 a.m. and we've talked about a few of the questions that you encounter even as you undergo the expedition your for your for the perfect fit for your graduate medical education goals. And we are gonna close the show, and I want to wish you a wonderful interview day.